All right, we're good to go.
Okay, good morning, everyone. Good morning, and welcome to what will be the last of our six webinar series on the journey to improving health outcomes and a roadmap for rural communities and rural hospitals. So we're very excited to have everyone here today. I'm excited about this webinar and that we have two fantastic guest speakers that will be joining us. And also, I just think it's so important that the topics that we'll be focusing on today is a great way to end our journey. So we'll begin. I don't want to take up a lot of our time because I want to hear from our speakers. And we also want to hear from everyone that's in the audience because we want to talk about the challenges that you're facing and the type of technical assistance you may need in order to move your initiatives forward. So we'll begin. The focus of this particular webinar is on improving health outcomes in rural communities, building long-term partnerships, and securing funding. We've come along this journey with defining terms, just laying a foundation with the various terms that we will be using, such as social drivers of health, social determinants of health, health-related social needs, health disparities, just to make sure that we're all on the same page, because sometimes even the terminology we use when we're talking about improving health outcomes within our communities is somewhat confusing. And then we started talking about the different elements of developing a plan to actually move toward the goal of improving healthcare outcomes in our communities, and the metrics and how do we measure health-related social needs and what are our Z codes. And so we covered that territory. We talked about the importance of engaging with communities because our rural hospitals cannot do this work alone. We must engage with our community, and this is focusing more on that as well. And also the importance of evaluation. How do we discuss return on investment? How do we look at the metrics, develop the metrics that will be measured to determine impact of the work that we're doing? So all of these elements hopefully are coming together, and now we're leading to the importance of developing these strategic partnerships and securing funding. So the objectives for this particular webinar is to provide examples of long-term strategic partnerships that improve health outcomes in Louisiana's rural communities, identify key funding sources to support rural healthcare initiatives, gain insights from one of our own colleagues here in Louisiana on strategic partnerships and securing essential funding to enhance health outcomes in the rural communities that they serve, and also to provide attendees with a platform to discuss challenges in improving health outcomes in their rural communities. We want to hear from you while identifying the technical assistance needed to drive progress in that area. So, beginning with strategic partnerships. What are strategic partnerships? Intentional partnerships. A strategic partnership is a long-term collaboration. Now, we're not talking about short-term, get together, let's accomplish this goal, and then we leave. No, we're talking about a long-term collaboration between two or more organizations that align their resources, their expertise, and efforts to achieve shared goals. And one organization may bring the expertise, one organization may bring the technology, one organization may bring the funding, but organizations coming together for that common goal. Strategic partnerships are mutually beneficial and can help organizations address challenges, expand services, and create sustainable impact. And sustainable impact is the key, which is another reason for the long-term collaboration. In rural health, strategic partnerships can help hospitals secure funding, improve patient outcomes, and enhance healthcare access in underserved areas. And that has pretty much been the focus of our webinar series along this journey. So, what are the key characteristics? And we've kind of mentioned them just a little bit, but let's get a little bit deeper. We mentioned a key characteristic of a strategic partnership is mutual benefit. And this is when each partner contributes resources, funding, expertise, infrastructure, and gains value from the relationship. So both parties, or whatever number of parties involved, are both gaining value from the relationship. And then there's shared goals. Partners align their missions to achieve common healthcare objectives, such as expanding services or improving health outcomes. And for us, ultimately, the ultimate goal is improving health outcomes. So that becomes a shared goal. And then there's a long-term commitment, as we stated before. Unlike short-term collaborations, strategic partnerships are designed to create a lasting impact. And then finally, resource sharing. Organizations share knowledge, they share technology, they share funding, they share workforce capacity to strengthen healthcare systems. So there's this sharing of resources, which is essential for our strategic partnerships. So what are some examples of strategic partnerships? And these are just some examples. There are many strategic partnerships, but just to give you some examples of what strategic partnerships may look like, you may have hospital and university partnerships. And that may be, an example may be a rural hospital partners with a medical school to create a rural residency program, attracting physicians to the area. That's a significant partnership. We mentioned when we were talking about evaluation that a rural hospital may partner with a university and work with graduate students to help develop their evaluation plan for their population health plan. So there are many instances where you can partner with the university and gather expertise and that mutual sharing and mutual benefit. Another example would be a nonprofit and government collaboration. An example might be a nonprofit health organization works with federal agencies such as the Health Resources and Services Administration or the United States Department of Agriculture to secure funding for rural hospital infrastructure improvements. Another example, public-private partnerships. Public-private partnerships. Example may be a state health department might partner with a private telehealth company to expand virtual healthcare services in rural communities, expand telehealth in rural communities. And then we have healthcare network alliances, which I think is very strong. These alliances where multiple small rural hospitals join forces to negotiate better pricing for medical supplies and insurance reimbursements. So again, these are just a few of the examples of strategic partnerships. I'm sure you can think of many of your own that maybe you've been involved with. So now, as I said, we're going to move to our next focus, funding. This was funding as it relates to improving health outcomes in our rural communities. Very important. And so I have a poll question here, and I'd like you to participate. We just want to get a foundation of, how familiar are you with funding sources that are available to improve health outcomes for rural and critical access hospitals in Louisiana? How familiar are you with those resources? Okay, so we see that we have about 13% say, yes, I'm familiar with funding resources that are available to our rural and critical access hospitals. And we have 33%, a third, that said no. And then we have 60% that said somewhat. And I love this because I love the fact that, yes, we have some that are familiar with it, but then we have a lot that we can share with those that are not or that somewhat. So this is great. Thank you so much for participating in the poll. So why is funding important? I think that's an easy question for everyone. Adequate funding gives rural and critical access hospitals the ability to what? To maintain and upgrade infrastructure, which is essential. Capital funding allows for the construction, renovation, and expansion of facilities and the purchase of essential equipment and technology. These investments are vital for delivering quality care and adapting to evolving healthcare needs. Funding is needed to sustain operations during financial challenges, and we're all aware of the financial challenges that our rural and critical access hospitals face on a daily basis. Many rural hospitals operate on thin margins due to low patient volumes and high rates of uninsured patients. Funding supports helps cover operational costs, preventing closures that would leave communities without local healthcare access. So again, very important. And then funding is needed to attract and retain healthcare professionals. We alluded to that in a previous slide. Funding supports competitive salaries, training programs, and incentives that are essential for recruiting and retaining healthcare staff in rural communities. Addressing the critical workforce shortage is absolutely essential. And then funding helps to implement community health programs. And this is where this journey has been targeted. Funding allows rural hospitals to engage in community health improvement efforts, such as preventative care initiatives and chronic disease management, directly impacting our local health outcomes. And that's what we've been focusing on. So again, let's give some examples of funding sources. And you all, there are many more than what we have listed here, but I just wanted to make sure that I was able to give just a few examples. For instance, federal funding. Federal funding provided by the U.S. government through agencies as the Health Resources and Services Administration, Centers for Medicare and Medicaid, and the U.S. Department of Agriculture, typically awarded through grants, loans, and reimbursement programs to support healthcare access, infrastructure, and also development. And here we have an example would be the Delta Region Community Health Systems Program, which is a federal program in Louisiana. And so our guest speaker is going to be talking about that. So I'm not going to say too much more about that program, but we're excited to have our guest speaker. And then we have our state funding, financial support provided by state governments, including Medicaid expansion programs, state grants, and rural hospital assistance funds, often allocated through state health departments and Medicaid programs to address local healthcare needs. And here I have an example of the Louisiana Rural Hospital Preservation Fund. And it's a state funding source specifically designed to protect and enhance the availability of inpatient and outpatient hospital services, particularly for Louisiana's rural residents through the Rural Hospital Preservation Grant Act. Okay, and then we have private funding sources. Funding from private funders encompasses financial resources that come from non-governmental sources, including individuals, families, corporations, foundations, and various investment firms, such as angel investors. Here I have an example as the Gates Foundation, formerly known as the Bill and Melinda Gates Foundation. But the foundation's current focus is on global health, development, and reducing extreme poverty. And we know that poverty is one of those health-related social needs that has a tremendous impact on healthcare outcomes. Then we have our philanthropic funding, financial support from foundations, nonprofits, and charitable organizations that focus on public health and community well-being, typically awarded through grants, endowments, and donations to support healthcare initiatives, research, and capacity building. And I have listed here the Robert Wood Johnson Foundation, which supports healthcare initiatives that improve health outcomes and expand access to care. And sometimes our funding sources are kind of interconnected. I have an example of the Rapides Foundation, which is a private philanthropic organization in Louisiana that focuses on improving the health status of central Louisiana, including rural communities and hospitals through grants and initiatives. And there are many more sources of funding. And I must put a plug in here that Well Ahead Louisiana is one of the most important resources for our rural hospitals and critical access hospitals in identifying the funding that's available. They not only have great information on their website, but they're also constantly, as new information comes in, sharing it, sending it out to our rural hospitals and critical access hospitals. So now I'm very excited to introduce our first guest speaker from the Delta Region Community Health System Development Program, Ms. Carmen Cooper-Okos. And Carmen, if I'm mispronouncing your name, please correct me. But Carmen, I'll just briefly introduce Carmen. She, having 35 years of rural healthcare administrative experience, Carmen was targeted to join the National Rural Health Resource Center in 2024 as the program director of the Delta Region Community Health System Development Program. In this role, Carmen manages a $10 million annual budget as awarded from the Federal Office of Rural Health Policy, which is a division of the Health Resources Services Administration. Carmen has 21 years of experience serving as the Vice President of Service Line Development and the Director of Rehabilitation for a Critical Access Hospital in rural Mississippi. She's our neighbor. She's a decorated rural healthcare advocate who serves in a variety of local, state, and national healthcare leadership and board capacities. This includes being a 6+ year board member for the American Physical Therapy Association, for which Carmen was elected by her peers from across the nation to serve based on her rural healthcare experience, leadership, and advocacy. Carmen earned fellowship status with the American College of Healthcare Executives, holds an MBA, holds bachelor and doctoral degrees in physical therapy, and is a licensed physical therapist in 14 states. She also enjoys working as a consultant to rural healthcare organizations, as well as working with legal teams as a medical expert witness. Carmen, thank you very much. And what I'm going to do is I'm going to stop sharing my screen now so that we can hear from Carmen.
Oh, my goodness. Thank you so much, Cynthia, for the introduction, and thank you so much for the opportunity to address your team today. Our federal project officer with the Federal Offices of Rural Health Policy regrets that she couldn't be here. You may have heard about this little thing called a federal communications embargo, for which she could not get clearance in time to speak to your group today. But as the program director, I can tell you everything you need to know. And if you're a note taker, you will not be disappointed, because I will walk you through step by step to see how potentially my program can become one of your strategic partners. Like Cynthia said, my name is Carmen Cooper Oguz, and I'm broadcasting live from the heart of the Mississippi Delta. I'm about 2 hours north of Jackson, Mississippi, and about 2 hours south of Memphis, Tennessee. And our Delta Rural Health Community Development Program, it serves the 8 states in and around the Mississippi Delta region, with Missouri and Illinois being the northernmost, and with Alabama. It does not have a border with the Mississippi River, but it does fit into our Delta region. Our Delta region aligns with, and this is the first thing you may want to write down if you're interested in maybe putting in an application for our program. I'll tell you more. The Delta Regional Authority, headquartered in Clarksdale, Mississippi, about 45 minutes away from my home, it also mirrors this 8 Mississippi River Delta State region. And even though it really doesn't have a targeted focus on healthcare, it does address issues and covers support in terms of workforce and leadership development. Delta Doctors is one of their programs that we can partner with them and get our HCOs in our program, healthcare organizations in our program, connected with. But if you're interested in finding out if your healthcare organization, and that's the acronym HCO, it can be a hospital or a clinic, if you're potentially eligible to apply for our program, when in doubt, simply email us, and I'll direct you to an email address in a minute. But if you can go to the Delta Regional Authority webpage, you can see their service area, and it's a big map, and it also lists the counties and the parishes around the 8-state region that our program is eligible to cover. There are 255 counties and parishes that are covered. There were just 252 counties and parishes up until about 3 months ago, but 3 new Louisiana parishes were recently added. And you can see that when you go to the Delta Regional Authority Service Area webpage. It'll show you a map. So if you go there and you're still in doubt about whether or not you're eligible, you can contact our program. If you could write down the National Rural Health Resource Center, go to our website and you will be directed to our program activities. We administer several grants through the Federal Offices of Rural Health Policy. But as Cynthia mentioned, I'm with what we call the Delta program, which is short for that acronym, Delta Region Community Health Systems Development. We simply call it the Delta program. under the program tab on our National Rural Health Resource Center webpage, you'll be able to go read more about the Delta program that I'm going to share with you today, but it also takes you to an eligibility page. We open this application process up all throughout the year. But at some point, as you can imagine, with that point being around the July time of the year, we have to cut off our applications in order to make a determination based on eligibility criteria, who we can move forward in our program. And we make that determination around August and September. Throughout the year, we do our internal eligibility vetting. Then we have to vet our potential program new cohort through our federal partners, and our federal partners are the Delta Regional Authority as well as the Federal Offices of Rural Health Policy. And I know you're probably thinking, well, Carmen, you're telling us how we can, figure out if we're eligible, but what can you do for us? Why should we reach out to you? As Cynthia mentioned, I administer the Federal Offices of Rural Health Policy grant, which totals $10 million a year. And with that money, we have eligibility criteria and we vet our rural hospitals. They could be PPS hospitals, FQHCs, critical access hospitals, or rural clinics to see if they fit the eligibility criteria. And once we can move forward with a cohort, we like to accept around 10 healthcare organizations a year, a healthy mix of hospitals and/or clinics from the 8-state region. And what we do is we put them through about a 3-year program if they're a hospital or FQHC, or a 4-year program if it's more of a smaller freestanding clinic, or maybe a clinic that's part of a greater healthcare system that is within our 8-state Delta region. And what do we do when you're a hospital for 3 years or a clinic for 4 years? We start by offering very comprehensive financial and operations assessments, quality initiative assessments, and then we conduct action plans on site with the assistance of our trusted consultation partners. If you've ever heard of Stroudwater, if you've ever heard of Forvis Mazars and the like, we contract through them to come on site to conduct all of these assessments and to facilitate these action planning events through which your team will be facilitated and prompted to come up with some goals that fit your healthcare organization and your community. We also do revenue cycle management and physician practice management assessments, and we also do equipment and software assessments that may result in your ability to potentially get some funding through our program to buy software and/or equipment that fits within a certain initiative that you've developed between my staff and between the consultants. And then we do, before it's all over with, we do a reassessment of everything that has been assessed to make sure you've moved in the right direction. And all along the way, my staff members, our consultants and our specialists and our coordinators walk you through and provide technical assistance every step of the way to make sure that you're getting the biggest bang for your buck in terms of program participation. So while we are the grantees of the Federal Offices of Rural Health Policy, we turn around and it's not a pass-through grant. We do provide these services and pay for them directly. But then we also offer some services that work with your community, like we identify a community champion through which you might be reimbursed up to 60% of a community champion's salary, because rural health care cannot operate in a bubble. We've got to have the community involved and engaged with buy-in. They've got to trust your healthcare organization. We've got to make sure that in some instances they don't think that bigger hospitals or bigger clinics or bigger towns are better. We can fundamentally address and with healthcare needs in your community with quality healthcare services that could be referred further if necessary, but through your community needs assessment and things like that, we identify what services are most needed in your community. And then by the end of it, like I said, we work with you throughout the program. We tie it up with a bow, and of course, we have to submit our objective data and assessments as aggregate. Your information that you pass forward when we collect data to connect with your consultants is kept private. That's between you and the consultant. So when we report our information back up to the Federal Offices of Rural Health Policy, it's just in aggregate. It's not, oh, well, hospital XYZ was doing this and we couldn't move the needle, or we did move the needle. No, no, no. It's all in aggregate. I will say that we've had wonderful participation from the healthcare organizations in Louisiana. And that means the National Rural Health Resource Center, have administrated this grant since its inception in 2017. At first, it was a pilot project, I'm not sure how many million, it ramped up to 10 million. It was for 3 years. Then it was so successful, the grant program got renewed for a 5-year cycle at $10 million a year. And we've just submitted another application as an incumbent to get another 5 years. But that said, I dare say that a majority of the healthcare organizations that have participated have come from Louisiana, and I won't call out this person on the call today. I do see one of our Delta program recipients, very successful Delta program recipients on this call, and the information about the HCOs that participate with us is public information, public knowledge. At least the Delta Regional Authority does a big press review towards the end of the year when we do accept and onboard a new cohort. So I just want to respect this individual's privacy because this individual is so important to our organization for a number of reasons, but this person is also so important to the state of Louisiana, not just this person's healthcare organization, because of the great work that they've done on their own too, but the Delta program has had the tremendous opportunity to work and make good things even better potentially at this healthcare organization and the community. So I'll leave it at that. If that person wants to speak up, this person can, but please go to the National Rural Health Resource Center. Click on the link that says Our Programs. You'll see all of our grants that we manage. The grant that your organization would potentially fall under, and I say potentially, is you have to make sure that you're within the Delta Regional Authority 255 counties and/or parishes. But here's the good news. If your organization happens to fall outside of one of my 255 counties or regions that I could potentially take you as an eligible healthcare organization and see if we can get you in the program. My National Rural Health Resource Center also has a grant called Rural Stabilization. We can't intersect. You can't double dip. Either you're in our region or you're not. And if you're not in our region, potentially, if you apply or reach out, we can route you to a rural stabilization program that we also administer. And if for the point in time that your HCO may be considering going the rural emergency hospital status, we know the organization that administrates that grant. We would have to point you in their direction because they could give you a lot of information and assistance with that. And then maybe you could apply to that program. But when in doubt, talk it out. Reach out. Let us help determine potential eligibility for any of the programs, and then let's get you started on some assessments and action plans and things like that, because I promise you this, we have seen it all with the program. We have seen hospitals and clinics that have been this close to closing their doors with hours of operating cash on hand, and we've helped turn them around and at minimum helped sustain the life of that healthcare organization for another year or two until alternate plans could be made for healthcare services within the community. We've also had high performing healthcare organizations apply, and we've helped them take it to the next level, and we've seen everything in between. So again, don't think that your healthcare organization may not be able to benefit from my program. It is not an admission of failure or success if you apply. Just, let's throw it out there and see what sticks. And I wasn't monitoring the chat box, Cynthia. I don't know if there are questions that perhaps I can answer, or
I think what we're going to do is listen from our next guest speaker, and then we're going to open it up for questions to both of you, if that's okay.
Sounds good. Thank you.
All right. Thank you so much. That was awesome. Thank you. Okay. Going to go back to sharing. All right, now I have the opportunity to present to you our next guest speaker that will be focusing using strategic partnerships and funding to improve health outcomes in DeSoto and surrounding parishes. One of our Louisiana exemplars, Mr. Todd Epler, Chief Executive Officer, DeSoto Parish Regional Hospital. And I'll tell you a little bit about Todd. Todd is retired from the Air Force in 2006 after 21 years of service, with 17 of those in healthcare administration. After retirement, he briefly worked for Christus and Willis Knighton Health Systems before accepting the position of CEO for Spring Hill Medical Center. In 2013, he transitioned to his current role as CEO of DeSoto Regional Health System in Mansfield, Louisiana. DeSoto is currently in a $51 million building project to replace most of their current structure that was built in 1952. That's 73 years ago. So this is exciting. And I'm going to stop sharing. And Todd, we're excited to hear from you.
All right. Thank you. Can you hear me okay? Okay. So first, appreciate Carmen and her acknowledging that Louisiana has parishes. Not everybody outside the state always acknowledges that. So appreciate that. And also shout out to Mary Ellen, who would probably be a much better speaker than me on this particular topic, but we do appreciate Mary Ellen. Look forward to hearing her comments after this. We are in the second year of the Delta program that Carmen was referring to, just kind of finished up our first year, all of those assessments, and would agree that those are very thorough and very helpful, and just a good assessment of where you stand as a facility. So we really appreciate that. I'm going to kind of talk about several different things, but to me, the key when you're running a rural hospital or for rural hospital success is to be willing to try new things and try to stay plugged in and make sure that you know what's out there. Your poll question about, are you familiar with funding sources? That's the CEO job one, as far as I'm concerned, certainly CFO as well. And oh, by the way, before I go too much further, you see that I got some folks in the room with me. Chris Davis is our COO. Then on the other side of me, Tanika Nash is our CFO. And then our population health manager, Candy, is here as well, Candy McGee. So folks that are critical to what we do. But the biggest thing I try to do, and what I told my board many years ago, is I'm going to keep trying to find new streams of funding, new resources, new programs, and things to do. And the other thing that I believe strongly is you try these things and not everything works. And unfortunately, a lot of people try something, it's not really working, but they just keep going down that road. So being willing and committed to ending things that don't work is just as important as being willing to try things. So I think that's really important. I've had several failures, and I won't go into those at the moment, but if you wonder, I could give you lots of war stories about things that didn't work and that we ended. But a lot of the focus when I heard about this was in our population health management program. And it's just one of those things that you have to experiment, you have to do. And so Candy is here today, and certainly she can answer questions when we get to the question and answer portion. But being aggressive in managing annual wellness visits, being aggressive in making sure that we're engaged with our patients and patient populations. It's one of those things that's a little difficult to say, we made X amount of money doing population health management. And sometimes it's not even about making money, it's about making people healthier. But we've done several different things in that program. I couldn't tell you right now off the top of my head how many more annual wellness exams we've done than we would have done otherwise, but both in Medicare and Medicaid, we do those, and that's been very successful. Screening exams, number of colonoscopies, mammograms, just all kinds of preventative exams. You know, we could give you stories of lives that were saved because of that. And one of the things that we really try to emphasize is, you know, we're going to see everybody. We're not telling somebody, oh, well, you know, you don't have insurance, or you're not this, or you're not that, you can't pay a copay. We're going to see them. We're going to take care of them. And we have a cancer center as a example that we had a community member that funded renovation of an area that said, hey, you know, mom had cancer, dad had cancer. We had to drive, you know, 30, 40, 50 miles to get cancer treatment at an infusion center. So they funded us to be able to open one of those. And we've done that, and that's been great. Several years ago, one of the nurses in that facility came and said, hey, you know, Mr. Jones, for example, he's not going to get his chemo because he thinks he can't afford it. He's worried about the copay. He's worried about the bill. And we were able to, you know, after much discussion and cajoling with him, to let him know that, hey, we're going to take care of it. Don't worry about it. Come get your care. And so he did. And so that's one of the things that we really try to emphasize, is just making sure that regardless of what the funding source is, or maybe there's no funding source, we're going to take care of those patients and do that work. You know, the other thing, just being aware of what the insurance incentives are, whether it's the Medicaid managed care organizations or the Medicare organizations. We have a lot of incentives that we get funded for, that we get paid on annually. Those things are really difficult to manage and to know what you're going to get and quantifying those things. But if you've been a member of an accountable care organization, which we did that, we went down that road and ended up getting out of that road. But you know, there's some good organizations for that. But just how do you manage, and how do you make sure that you're staying on top of those things? So we've done a lot of that. We also have community health workers, and Chris Davis is a COO who's also a community health worker, but we have others as well. But we've had success stories in that, people that we've managed to touch their lives and change their lives and do great things. And I'd love to tell some of those stories at some point. We just don't have time today. But another one of our initiatives, community school-based health centers. We have the only pediatrician in DeSoto Parish, and as far as I know, we also serve Sabine Parish. I don't think they have a pediatrician either. But right now, we're in the DeSoto Parish schools. We started with the Mansfield middle school and elementary school, and we're doing school-based telemedicine visits with our pediatrician. And you know, we haven't done a huge number of visits this year, but it's been very successful in the ones that we've done. and just getting folks familiar with us and getting folks comfortable with that. So we've had, a lot of really good interactions in that way. And also, that ties us into our community and gets those kids hopefully accessing care earlier and in situations where they might not have otherwise. But one of the things that I'm an advocate for is making sure that we attend as many conferences, as many seminars as we can, whether it's the Louisiana Rural Hospital Coalition or Louisiana Rural Healthcare, I can't remember the other, LRHA, but well ahead, so many different opportunities to go and attend and learn about things. And things like chronic care management, we've outsourced that with a partner that allows us to engage our community through that program. Another program that we learned about through one of those conferences or for networking, there's a company called Together MD that reviews our inpatient coding. And that is something that has worked really well for us, just in terms of helping our providers code better, helping us to get some more money. And that's on basically a contingency basis. So when they help us, when we get more money, they get a piece of that and we get a piece of it. So that's just one of those programs that we have done. Another one that I have spoken about previously in some of these forums is Target Health, which is a company here in Louisiana that is in the population health space. We hired them. We signed a 2-year contract for them to help us learn about these insurance incentives, learn about the various databases where patients can to access all the various things that they've already done. And so we did a 2-year contract. They came on board. They helped us. They trained us. And at the end of that contract, we didn't renew. I mean, they certainly could have, but we felt like we got the purpose of that. So that's just, you got to constantly evaluate and update those things. The other thing I'd say, just in terms of evaluating and finding resources, what makes these programs work is the people that you hire. So, or identify. Sometimes it's hiring somebody from outside. Sometimes it's identifying somebody that you have in-house that can do that work. And again, if somebody isn't a self-starter, if they're not able to do it, then move on back to whatever you were doing. Let's find somebody else to do that, or let's into that program. But it is critically important to make sure that you put the right people, right personalities. Sometimes it's a personality. Somebody that's great with kids can do telehealth, and somebody that's great with computers might do something else. But managing those things, also making really sure that your contracts are solid, that you have out clauses, that you have right reimbursement, all of those kinds of things are very important. And then I mentioned it before, but the Louisiana Rural Hospital Coalition Conference, these other conferences, there's one program that's a statewide program that I was sitting in a rural coalition, and I said to the next guy sitting there, "Are you aware of this?" He went, "Oh yeah, we're in that." I'm like, "Why am I not in? What's going on?" And so I was able to look that up and figure out how to participate. And most of these things that I mentioned to you, we're netting $50,000 to $100,000 a year on each of these little programs. But if you add those up, pretty soon you come up to a pretty good amount of money. But 340B is another one that some folks are not in 340B. If you're eligible and you're not in it, you're throwing money away. So there's just so many things out there that you have to engage in and attend conferences, network, find out what other rural hospitals are doing. And then you briefly mentioned earlier foundations. We do have a hospital foundation. You never know. Our hospital foundation, the first 10 years that I was here, we probably fundraised and made 30 to $40,000 a year through our foundation, and that's great. We're happy with that. But last year, as we're working on this building project, and Terry, our foundation director, is just in the community, somebody reached out and said they wanted to give us $1 million. And we're like, yeah, okay, go ahead. That'd be fine. So she's in fact already given us $333,000. She's going to give us another third and then another third of that $1 million pledge. And also, again, having an active person managing that foundation. She had talked to a company that's called Chesapeake Energy that's here in our area, and they had promised to give us a truck or give us some money, and they just had never worked out. And finally this year they came and said, okay, we do this annual golf fundraiser, and oh, by the way, they merged and now they're called Expand Energy, so they have a new title. But because Terry had networked and did with them, they have this golf tournament that raises $200,000 to $300,000, and we're going to be the beneficiary of that golf tournament. So, there's just, you never know where that money might come from. And we have some very loyal folks in our community that, will donate $5,000 to $10,000. We have some businesses that do that, but we wouldn't have had that money. We wouldn't have those funds if not for somebody engaged in the community and constantly. And again, I love Terry, because you can tell her no today and she'll come back tomorrow, and you can tell her no and she'll come back the next day. So she's never deterred. So anyway, those are just some ideas that we've had, some things we've done. I know we're kind of running into that time. So I'm happy to open up for questions, or if you want to let Mary Ellen kind of give her experience, that'd be awesome as well. Cynthia, I think you're muted.
Yes.
There we go.
This is great. I mean, I don't know if I wrote down questions if we don't have questions from the audience, but yes, I saw that. Mary Ellen, would you like to speak?
All right, I was trying to get off of mute,
Okay.
and now you can see me. So you did a great job, and one of the things I want to say up front is that he talked about going to meetings and learning from the different experiences you have in those meetings and the ideas that come from it. I just want y'all to know that I take a lot of his actions and implement them. Target Health was one of those things. So I think thanks to Well Ahead for putting these types of webinars together so that we can learn from each other, because I learn the most from my colleagues. Because not only do you hear it from a perspective that this is a good concept, you hear it from the perspective that we actually could do it. Like it's, from the implementation perspective. So I think this is great. And just want to reiterate some of what Carmen said about the Delta program, because we have graduated from that program, had 3 strong years with it. And from the perspective of, I am what many would look at as, oh, we're, pretty successful rural hospital. We're not on the brink of closure in any of those ways. But I was surprised how much I didn't know about my organization from the perspective of what the consultants brought forward. And I think I know a lot about my organization. I've been here for a long time. And so you don't always know what you don't know. And I think having consultants come in with a different perspective, a broader view of what's going on across the country, can shed some real light on what you might see as just normal in your organization. So that was extremely valuable. The other thing, though, I think that was so great about the grant is that it's not consultants coming in and telling you what you should do and then walk out the door. It is shoulder to shoulder support with technical assistance. So when it comes to this is a good idea and you've got to implement it, you can ask for technical assistance, which brings the consultants more from this is a good idea to this is how you do it, and walks you through it to really leverage your team. And we all know in rural faith that we all have like 10 jobs, we wear all these different hats. So trying to get some of this work done is not necessarily an issue of lack of competence. It's really a lack of capability from all the other things that you're working with and working on. So having that additional support really helps expedite moving things forward. I was astonished at how much we got done in 1 year. I could not have done it with just my team, even though they're very capable. We needed that support. And so it's a great program. And I think wherever you are in your, organization's performance, you're going to learn something and you're going to be able to really implement some change for the good. And I think that's probably the biggest thing in all of this performance improvement and collaboration and stuff is just the willingness to reinvent yourself and continue to change. I see Todd as one of those people. He's always got new ideas. He sees something, he tries it. He doesn't, resist changing his organization. And I think that mindset is what you need to be successful, especially in this environment as it's changing rapidly on us. So that's all I want to say. Y'all all did a great job, and thank you, Well Ahead, for making these things available to us.
Thank you very much. That was very helpful, just to hear more about, those that have been exposed and received this certain type of funding. I would like to open it up to anyone else that may have any questions. You can unmute your line or you can raise your hand, but is there anyone else that may have any questions? I just want to, Carmen, I have something just until we may hear from someone else, but you mentioned the eligibility criteria, and without getting too extensive or detailed, are there some broad components of that eligibility criteria that you could share with us?
Yes, there are. And, again, I'll say when in doubt, let's talk it out, because there are some things that are in black and white, but there are also, and we learn this every application cycle as well, there can be some gray areas through which we need to work. But, first of all, it starts with the Delta Regional Authority's definition of service area. But I have some information for y'all right now, hot off the presses. This email came through at 10 minutes after 11, and pardon me while I get this information for you. A few months ago, the Federal Offices of Rural Health Policy wanted to develop some initiative whereby you didn't have to run around guessing which program you may be eligible for. At 11:10, the federal offices released an email, and they said, share this now. There is a link accessible on the RHI Rural Health Innovation Hub homepage. So I can also give you a direct email link. And this is not just eligibility for my program. This is eligibility from any program. So it eliminates a lot of the guesswork and the steps and the red tape and the passing around. So if you go to the RHI Hub homepage, or if you're a note-taking person, ruralhealthinfo.org. That's ruralhealthinfo.org/hospital-TA. www.ruralhealthinfo.org/hospital-TA.
That's awesome. Thank you.
Yeah.
We feel privileged to get this hot off the press.
First, you're the first to hear. Yeah.
Thank you so much.
Thanks for the question.
Thank you. And Todd, I have a question for you. I think it's awesome, the work that you shared. I was very interested in the fact that the importance of attending conferences and networking, and how much that contributes to that community engagement, and also opportunity to establish these strategic partnerships and to obtain funding. So I thought that was absolutely awesome. And I thought that idea of not being afraid to try something, and if it doesn't work, then quit it and then find something new. So if you could just share some more in terms of how do you all continue to develop on, especially I'm thinking now in terms of the population health management plan, and identify the metrics that you're using in order to measure like things related to health related social needs or social drivers of health, and addressing those things, I think, when you hear population health management program.
Yeah, so I mean, it's really tough to do because, you know, here in Louisiana, we have 6 Medicaid MCOs, and you have any number of Medicare Advantage plans, and then you have commercial plans, and all these different plans have their own, you know, set of metrics. So Candy has a huge job in terms of just trying to make sure that they're focused on the right ones, and focused on the insurance company representatives who are identifying, okay, you know, by the time we get them right, they change them. And that's just kind of part of the fun of dealing with insurance companies. But, you know, it's generally going to be, you know, let's focus on HEDIS measures. Let's focus on getting these patients in and identifying who they are and what they are, and then just evaluating how to help that. So Candy or Chris, y'all want to?
I will just add one thing. I think it's very important to have a relationship with the representatives from each payer, and have standing meetings where you can actually discuss, you know, monthly or even quarterly where you are on the metrics, you know, and your numbers, how many you need, and just staying on top of it through them. And they'll send you, you know, here are the patients that are non-compliant. Well, then we have a team that actually reaches out to those patients specifically saying, Ms. Jones, you haven't had your mammogram. Let me get it scheduled, which also, DeSoto Regional has mammography. So we're going to, you know, they're going to come back to us for their mammogram. So it's just a rolling, you know, a rolling thing that, but it is very important to have a relationship with each of the insurance payers to stay up to speed on each company, and then different measures, because they do change.
And during our journey talk in relation to addressing improving health outcomes in rural communities, we did to discuss community health workers. So I became excited when I heard about the fact that you all utilize community health workers. Can you give just a little snippet about how they're utilized at your hospital?
So right now we implemented our community health workers in our rural healthcare clinic, and we tie it with our telehealth services that we're doing at the school. So that school nurse, who is one of our employees, actually upon just registration, you have the standard questions. You know, are you having transportation issues? Are you, you know, scared you're gonna lose your home or anything like that? So once we implemented that, we created a referral process, and I can definitely tell you, it has opened up to me, being so passionate about patient care, it has actually opened up a direct connection with our patient and our providers. I'll give you an example I just shared at our Delta Region meeting on last week. We had a patient young guy, who was not, we thought, or the provider thought, not compliant with their diabetes, the treatment plan that they set forth. Patient coming into the clinic, his glucose is greater than 444. His hemoglobin A1C was greater than 14. So again, what we have implemented when you're having difficult situations like that, go ahead and refer them to the community health worker to see if there's a problem or a situation that is a barrier is the reason why. So refer the patient to the community health worker referral process. I happen to be the CHW that was actually working with that patient. And the barrier was he was actually afraid of needles. So the provider had created a care plan where he had to check his glucose every day, hence with the needle, then give himself an insulin injection, hence with the needle every day. He said, I am afraid of them. I'm terrified. All right, let's come together. All right. So now we've identified what that barrier was. Now, how can I, as a CHW or as an organization, work with the provider and the patient to bring it together? So we created basically a care plan, a treatment plan to get him more comfortable. Again, had to bring him in every single day. So for this week, for the first 3 days, I want you to come into the clinic every day at noon. I have the nurse to go over how to give the injection, how to check your glucose, okay? And then on Thursday, we're gonna allow you to administer yourself, come here. But in the meantime, I'm also working with the provider, and this is where that partnership comes in. So we also have a partnership with a local company, MLK Pharmacy, who actually gives us or help us with our diabetic patients by doing nutrition consults, working with us because they have a grant, right? So I reached out to them, hey, you have a diabetic educator. Help me help this patient. They refer back to, hey, have you thought about, the pre-insulin so he don't have to draw it up every day? Because think about it from a psychological perspective. He is seeing the needle go in, draw the insulin. He's so fixated on the needle. I was like, great idea. So I went back to the provider and then shared that. And she was like, wait, I didn't even think about that. I said, So then to help with that, I called the patient and said, hey, have you heard of free Libre, where you can put this device on your arm, it reads your glucose, you see it on your phone, and you don't have to prick your finger. He's like, I would love that. Brought him back in to do it. So long story short, week 2 later, working with him day to day, his glucose was 95. He is so excited. Now we're going to follow up in a couple months to bring him back in and do his glucose check. His hemoglobin A1C. And now as the CHW, that particular case is pretty much closed. However, I'm checking in, like how you're going, how you're doing. It's just making sure that I would like to now see it through in 3 months. I want to see that hemoglobin A1C. I say 6, 7, but that's kind of where our community, one aspect of how the community health work is actually help that social determinants of health, help the provider really get a better understanding of what's going on with their patient, because they don't have the opportunity to do that in the clinic right there when you got a schedule full of patients. So I'm excited.
That's awesome. And I feel your excitement. I feel your excitement. I think that's awesome. You all, we're at the 12:03. I think we could go another hour, but we're not going to be able to. But I do want to, Todd, really thank you for inviting your whole team to come forward. That's awesome. We appreciate your time. And Carmen, we want to thank you for taking time and then sharing this hot off the press information for us. I'm going to go back to sharing just briefly. Let's see. And we had an awesome time today. I've learned so much. I just wanted to share with you the next steps. This is, as I mentioned earlier, this is the last webinar of our 6 webinar series on journey to improving healthcare in rural communities through our rural hospitals and critical access hospitals. I will be available for individualized technical assistance up until the end of June to rural and critical access hospitals in Louisiana, as we focus on those items, those principles, strategies that we discussed during this journey, this 6-month journey that we've been on. I wanted to share with you some examples of that assistance. It may be helping assisting with developing a rural population health plan. It may be assisting with reviewing and enhancing your population rural health plan. It may be on training staff on social determinants of health, health-related social needs, on creating an evaluation plan for population health initiatives. We talked about how important it is to evaluate. And I think when Todd mentioned about you try something, if it doesn't work, then you put it down. You go with something else, but you have to have metrics on which you're going to determine, is this working or is this not working? So that some form of evaluation has to be put in place. And then also engaging leadership in C-suite. And I just truly appreciate Todd saying that as the CEO, he felt that addressing the funding issue was a primary component of his role as a CEO. So we said at the beginning and early on in our session that having those in leadership executive positions within our healthcare system is so important to be engaged in this work efforts to be successful. And these are the resources. And I just want to say thank you. I've enjoyed these 6 months with you. I hope that you've gained some insight in some areas. I know I've learned a lot in this 6 months, and I truly appreciate you. Again, you have my contact information, and if you can't contact me directly, you can always contact the great people at Well Ahead, and they'll know how to contact me. And now my last request is that you please complete the evaluation at the end. We have an area to evaluate this webinar series, this particular webinar today. And then for those that have had the opportunity to attend 2 or more of our webinars, to do kind of an overall evaluation of the 6 webinar series. So this information would be very helpful in really in identifying what type of technical assistance will our critical access hospitals, rural hospitals need in order to actually move forward and implement their plans to improve health outcomes in their community. So I think we're at 12:07. I thank you for those that were able to stay into the end. And again, I truly appreciate Todd and Carmen for taking time out, and Todd and your team and Carmen for taking time out of your busy schedules to share with us. Again, I think we could last another hour if we had the time. But thank you very much, and you all enjoy the rest of your day.
Thank you.
Thank you.
Thank you.
Thank you.